Now we're going to work the QL. So I'm going to have you straighten your leg over your other one like you're standing. There you go. So I remove the blanket to work the QL, but I leave the sheet. And I do this for everybody, even men, just because I like to use the friction of the sheet to kind of help grip the QL. So now what I'm doing is I'm using my thumb and fingers here to kind of massage it a little bit and feel where the tightness tends to be. There's 3 points I've noticed that are common. Right in the center, and then the ribs, right at the base of the bottom rib, there's a tight spot right there. And a lot of people will come in complaining of that spot. And then right at the top of the sacrum, right in here, there's a tight spot, and people will complain about that too. So there's 3 ways. There's, well, 1 way for each spot to release. What I like to do first, because sometimes this will work for every spot, and it'll save me time, is to get a good grip of that entire QL. And this takes a lot of hand strength, so this will take practice. But I just kind of grab it just like this. And I instruct the client to, when I tell you to, go ahead and bring your hip towards your ear like you're a belly dancer. And then when I tell you to bring your heel towards the wall, lower your hip and your whole entire leg, pointing your heel towards the wall and your toes towards your head. So there you go, just like that. Okay? All right, so now I'm going to grab the QL, and I'm really squeezing it. And sometimes people will hike their hip up towards their ear a little too far, and it'll pop you out, so you have to tell them to lower it a little bit. Okay. So I've got a good grip on this QL. Go ahead and bring your hip towards your ear, Leah. And hold right there. I hold this for 10 seconds. And relax. Okay, did a little release, so go ahead and bring your heel towards the wall. And I hold that for 10 seconds. And relax. There, it kind of melted with that one. Okay, so now under the, well, at the bottom of the ribs, right where that QL attaches, right in there, I'll use my thumb. I don't use my thumb like this. That's overextending. You're going to hurt yourself. I use the point of my thumb, and I push straight down using the inertia of your whole arm. So straight down. And this does not feel good to a client, especially when they have pain here. So this is something they're going to have to breathe through. So be very empathetic when you apply that pressure. Don't just dig in. You want to apply it gradually. Okay, so go ahead and bring your hip towards your ear, Leah. And keep the pressure on. Count for 10 seconds. And relax. This one I do not have her point her heel towards the wall because it tends to tighten the QL back up. So you just want her to hike her hip towards your ear. And that really did a good job loosening that muscle up. Okay, so now I'll show you how to release the insertion point of the QL at the sacrum. So let me get back here. What you want to do is palpate the top of the sacrum, get your forearm in there, and now bring your heel towards the wall, lowering your hip, and really stay with it and push. And count to 10. And relax. Okay. That feels a lot better than it did when she first came in, or when I first started working it. There's a little tightness right in here that didn't get released. So I'm just going to put my thumb in it Okay, go ahead and bring your hip towards your ear. And I'm only going to do that for 5 seconds and release. Okay, that did the trick. I wasn't on the kidney. You want to make sure, well, the kidneys are back here. I wasn't on an organ. You don't want to be, you want to like push into the muscle. So just make sure you're on muscle tissue. You can feel the difference. Okay, so now I'm going to have her bring her arm over her head. And now point your heel towards the wall. I'm just grabbing onto that sacrum and I'm pushing with all my weight. I have you take it, go ahead and relax your leg and just breathe nice and deep. This is an opportunity for you to get a good stretch. So I like to keep my feet flat on the floor and get a nice calf stretch out of it. I lower my head and get a nice stretch in the back of my neck. And I keep my whole body as straight as I possibly can. This is actually important for you to do because after 5 of these in one day, you're going to be pretty tired. So you want to stretch out as much as possible. Okay, and relax.